Good afternoon. We ready? So as you can see, we have significantly reduced the number of city staff here today at the daily briefing to ensure we are practicing appropriate social distancing. Rest assured, though, the city's leadership is fully engaged in all COVID-19 related activities. If there are specific questions that we are unable to answer at this forum today, we will certainly endeavour to get those answers to you shortly after this briefing. We are also working to establish a permanent conference phone line for you, together with our YouTube live stream for future briefings. Once we've established that, we'll share how best for you to call into these briefings. Also, just want to address some public concerns about appropriate social distancing at the Emergency Operations Centre based on photos and video that was captured last week at our EOC Avail. We have since, I want you to know, altered the workstations up at the Emergency Operations Centre to ensure that there is appropriate social distancing. The situation, as you all know, has changed significantly since last week. We're not going to reschedule a photo opportunity, but I thought it important for your viewers and readers to have that context. With that, we are joined today by Fire Chief Matthew Pegg as head of the city's Office of Emergency Management, who has been leading this city's operations and response to COVID-19 since January. As well, we have with us Toronto's Medical Officer of Health, Dr. Eileen de Villa, who has continued to lead admirably the city's public health response to COVID-19. This daily briefing is live streamed on the city's YouTube channel, so I ask that you please use the microphone when asking your questions. And with that, I will turn it over to Chief Pegg.
Thank you, Brad, and good afternoon. Yesterday, following the declaration of a provincial emergency, the City of Toronto took a number of actions to help prevent the further spread of COVID-19. City Hall, Metro Hall, and all City of Toronto civic centres were closed to the public, and all non-essential or critical staff have been assigned to work from home. In addition to the services that we announced would be suspended earlier this week, further service impacts include weddings. The wedding chamber at City Hall, North York, Scarborough, and York Civic Centres are closed, with all permits for the use of these chambers being cancelled. New bookings are suspended. As registry service counters are closed at all civic centres, the issuance of marriage license is also suspended. Inspections. Non-emergency building, bylaw, dine safe, and body safe inspections are suspended. Emergency inspections related to health and safety will continue and will be prioritized. Employment services. 3 Toronto Employment and Social Service locations are providing critical services. Other offices have been closed. Clients must call the office first and will be asked COVID-19 screening questions before attending in-person meetings. Payments are not impacted. Housing services. Access to housing offices are closed. Payments and processing continue. Courts. All court service office and service counters are closed. Provincial offences courts are closed. All scheduled matters are postponed across the province as per an order by the Chief Justice of Ontario. Public consultations. All city public consultations have been cancelled. The suspension of consultations will cause delays in the processing of planning applications. City planning is looking at how this may impact legislated timelines and how to address these delays. Council and other meetings. All council, committee, tribunal, and community meetings are cancelled. Business licensing. Business licensing, issuing, and renewing is suspended. In some cases, licenses can be renewed online. Enforcement of expired business licenses will be suspended. Just as importantly, many critical services continue, including all emergency services, including police service, fire service, and paramedic service emergency response. Toronto Water continues to ensure our drinking water is reliable, safe, and remains at the high standard we have all come to expect. Shelters and respite sites remain open. City-operated long-term care homes will continue to operate, but with no visitors permitted at this time. Garbage and recycling collection will continue as scheduled, but yard waste collection has been suspended. If you have put yard waste out for collection this week, please remove it from the curb until further notice. Road operations, including snow removal services if required, will continue as normal. Toronto Hydro is operating normally. The TTC is operating normally. 311 continues to operate normally. The city's infrastructure remains safe and reliable, and the city will ensure that that continues for all residents. All information relating to adjusted and suspended city service levels is continuously being updated at toronto.ca/COVID-19. As city services change or are modified to continue to meet resident needs, we will advise you here each day, as well as updating the city's website to reflect those changes. The city is keeping its workforce updated with the latest information about COVID-19 and service impacts as well. A number of online tools, an employee hotline, and a manager's guide have all been developed for our workforce. As I have repeatedly explained, our public health call centers continue to experience an incredibly high volume of calls. Many of the questions being asked can quickly be addressed by accessing toronto.ca/COVID-19. I encourage everyone to make this your first point of access for reliable and credible information. And again, please do not call 911 when seeking information about COVID-19 or city services. 911 is for use in emergency situations requiring response by Toronto Police, Toronto Paramedics, or Toronto Fire Services only. I want to thank the Toronto Public Service, our government partners, and especially the public for all they are doing to help flatten the curve. Our collective efforts in following the advice of our Medical Officer of Health will make all the difference in keeping Toronto safe and resilient. In closing, let me confirm that as the Fire Chief and General Manager of the Office of Emergency Management for the City of Toronto, I have been leading the city's emergency and operational response to COVID-19 since this virus became a global concern, and I continue to do so. I will also note for you, as I've said many times, we have robust, nimble, exceptional emergency management processes in place in the City of Toronto. The Emergency Operations Centre is operating at a level 3. We talked about that yesterday. And the response to the ever-changing COVID-19 circumstance and situation is an ongoing process literally every day. As the subject matter expert in public health, Dr. de Villa has and continues to lead the public health response to this pandemic in Toronto. I will now ask Dr. de Villa to update you.
Thank you, Chief Pegg, and good afternoon, everybody. Since our last update, we have 7 new cases of COVID-19 to report in the city. And as anticipated, we are seeing increasing local transmission with 11 cases under investigation. Overall, we're observing that many businesses and many people in the city are complying with our recommendations around social distancing. In fact, yesterday, when we had staff go out to survey businesses to see how much compliance there was with respect to new orders and closures of bars and restaurants to dine-in service and moving exclusively to takeout or delivery options only, when we went out to check that compliance, we have found that only 4% of the businesses that we went out to look at were not in compliance. This is amazing. Just hours after the order was issued, we had that level of compliance, and on St. Patrick's Day, no less. So thank you. Thank you to the residents of our city. Thank you to business owners. Thank you all for doing this. But we can still do better. We must do better. And we need your help to get there. People are asking me, they're asking me questions on what social distancing looks like. Social distancing means avoiding contact with others. Social distancing means keeping 6 feet apart to help prevent virus spread. Social distancing means staying home and only going out for the absolute essential needs like food or medicine. Social distancing means reducing contact with others. Social distancing means working from home. Social distancing means helping your employees to either stay home or to work from home. Social distancing means doing your grocery shopping online, or maybe having somebody else do your groceries for you. This is a new concept for us. We are new to social distancing. So I want to be perfectly clear. Having your friends over for dinner or for coffee is not social distancing. Arranging play dates for your children is also not social distancing. Visiting friends or family in long-term care homes or hospital is not social distancing. Stopping at a grocery store to stock up after travel, including travel to the United States, is not social distancing. This is a challenging time. Your federal, your provincial, and your local governments are all taking extreme action, as you've seen in the last few days. Extreme action is now also needed from you. We all need to take these personal responsibilities seriously. We need to practice social distancing seriously. I'm asking everyone once again to please make every effort and take every opportunity to practice social distancing. Stay home, stay safe, and take care of each other. So with that, I'll wrap up my remarks and take any questions that there may be.
Dr. de Villa, if we could start with you, and I have a follow-up for Chief Pegg. Can you hear me okay?
I can, thank you.
Okay. Interesting that you should use this time to continue to push the point about social distancing. Are you finding that people simply aren't getting the point at this time, and there's a need for this? Or maybe people are starting to relax and get back to their normal routines?
Well, I think what we're seeing is quite a bit of compliance. I have seen businesses send employees home and encouraging work from home. I have seen individual residents refraining from going out, not doing play dates or gatherings. But this is really important. We know from other jurisdictions that social distancing works. But just like any other medicine or treatment, it has to be applied appropriately, right, in the right dose for the right amount of time. So we do need people to really stick with this. We've been very impressed with the compliance thus far, but I'm really encouraging residents, businesses, everyone in this city to really get behind social distancing. We've seen the impact that it has had, the positive impact that it has had in other jurisdictions, and if we want to have that same kind of effect here to reduce the spread of virus in our city, we really have to stay the course with social distancing and take our own responsibilities for ourselves, our families, and our community very seriously.
Chief Pegg, if you would, a quick question for you. We've learned that you have a director in the Office of Emergency Management that is no longer there, has been removed from the position. Is now an appropriate time to get rid of a director from a very important division here at the city?
Thank you. So, as you know and as you can appreciate, the City of Toronto doesn't comment publicly with respect to personnel matters. But I can tell you that the operations within the Emergency Operations Centre and the COVID-19 Task Force are continuing. We have a very robust, very effective incident management process in place. That work is literally ongoing as we speak. I am incredibly pleased and incredibly impressed with the work that is happening in both of those groups every day. This situation has been well managed by the city from the start, continues to be well managed, and I have no concerns whatsoever with respect to our ongoing capability and our forward-looking capability.
Dr. de Villa, I believe you mentioned you believe there are 11 cases now of community transmission in the city. I know you won't speak to details about specific cases, but is there anything that your investigation has shown in terms of locations or events or connections with those cases?
So we don't have any specific details on the cases that would link them together, other than to say that they do not appear to be linked to travel outside of Canada, nor do they seem to be linked to close contact to an existing case. So by definition, they appear to be related to community transmission, but with no specific, singular location that ties any of them together.
Yesterday you were mentioning that the steps that are being taken are like a prescription, that they have to be followed, like a medication, they have to be followed, taken for the right amount of time, the right dose. These things that you've talked about that have made people's lives challenging, does this prescription last, in your estimation, for days, weeks, or months?
Well, I think we're still trying to figure that out, frankly, as a global community. We know that we're talking about a virus that was only discovered in January. So it's a virus with which we're still unfamiliar and still very much in the learning phase. So we have seen other jurisdictions that have had to apply these social distancing measures for so far weeks, because that's how long we've been with the virus. So the course has yet to be determined. And just like with any treatment, it's a question of applying the treatment and seeing whether we're getting the desired impact and adjusting the course, depending on what we see.
Dr. de Villa, listening in to the Ottawa briefing today with Dr. Tam was talking about how they're considering the possibility of coronavirus coming in more than one wave. Is Toronto Public Health making any similar preparations for multiple waves of COVID-19 impact?
Yes, of course. We do liaise regularly with our provincial and our federal counterparts, and I've had several discussions with Dr. Tam on this issue and on the COVID-19 response. So absolutely, I think we are all looking at the same science in order to inform our efforts and our response. And when it comes to respiratory diseases, we do sometimes see multiple waves of disease. So we shouldn't be surprised that there might be the possibility of a second wave, and we should be preparing for that. So
if the numbers if the Toronto new patient numbers were to suddenly drop, that's not necessarily out of the woods. They could easily rise again.
That is a possibility, and I think that, as I said with the previous question, the thing is, like with any medical course or public health course of action, you apply what you feel are the appropriate measures or the appropriate treatment, as the case may be, observe what kind of impact you're having, and evaluate next steps premised on what you see.
Dr. de Villa, can you clarify as to why the numbers we're getting from the province aren't always consistent with what we're hearing from you? Yesterday, just checking from my team, the province disclosed 3 new Toronto cases today. You just said 7.
So we have different times at which we pull the data, and the data are constantly being entered into the system. Cases are being identified, and when we enter them into the system, and we pull data may be quite different from when they actually go into the provincial system and when they pull them out. So it is a constantly evolving situation, and it may be just a simple question of when did we enter the data, when did we pull the data, when did they get their data, and when we're actually speaking with you.
Just to clarify, so would the most updated numbers then in the province be what you're providing now, 7?
I can't speak to what the province provided. I can tell you that the number I have is what we have from our city reports premised on when we pulled the data last.
So my other question is, we're hearing from people who work in spas, nail salons, hairdressers, hair salons, that they're not being shut down. And as employees, they have to go to work. Their boss is like, we're open. What's the message? I mean, should these facilities not be closed in the city, considering particularly, I mean, everything else is closed and the close contact people who work in these settings have with people's faces and bodies?
So what we're trying to do is provide the message that social distancing is absolutely important. And if people actually follow the advice and follow the recommendations, whether as individual citizens or as employers and businesses, I don't think we'll be dealing with that problem. So again, the main point here is around social distancing. Social distancing works, and what it means is staying home, working from home where that's doable, and if you're an employer or a business, making it easy, setting up the circumstances so that your employees can stay home and stay safe.
I actually see the city manager there, and I actually have a question for you, if that's okay. Just hearing about, just going out and about, you can actually see Toronto police or traffic enforcement officers still issuing tickets to people. You're telling people to stay at home. There are areas where, obviously, when they would probably be at work, shorter-term parking. Should the city be suspending that to allow people to stay in certain areas that are closer to their homes? So, it's a loss of revenue, obviously, but should you be still ticketing people when you're telling them to stay put?
We haven't set aside our bylaw requirements. I mean, we are still, delivering services as we were before all of this happened. But with every situation, I mean, we're evaluating it literally hour by hour. So if that were the appropriate thing to do, we would do it at this point in time. There are still those services being provided. So to suggest that it won't change in the future, I think, is impractical at this point. So I appreciate the question, and it's worth reviewing.
Is it harder to review these when you obviously don't have city council or others, at the table or with community meetings where you can actually really get that directive?
Right. I mean, we're in exceptional times, I think, as the people standing behind me have said. And so, they're expecting me to use my judgment, which is what I'm paid to do. And so in those circumstances, I'll get the best advice I can from the people I'm working with, and we'll make an appropriate decision.
Okay, this question is for Chief Pegg. Yesterday you tweeted that there were some COVID-19 test kit scams that were going around. Just hoping you can elaborate what are in these test kits, what type of scams are these, and how many people have been affected?
Yes, thank you. So I have not seen I've not seen this myself, nor have I been contacted myself. I became aware yesterday in one of the business cycle briefings in the Emergency Operations Center, and then subsequently with some information from a couple of different police agencies. What I have been told, and my understanding is that there are a number of scams that are emerging. As it's been relayed to me, one of them involves people trying to sell residents what they're marketing as a COVID-19 home test kit. We've received information that others are attempting to pass themselves off as employees of Toronto Public Health or the Toronto Public Service. That's absolutely untrue. That the Toronto Public Health nor the Toronto Public Service does not go door to door, is not selling COVID-19 home test kits, because there are none. We also understand that there are now also a number of other online scams ranging from fraudulent loan applications and this plethora of just vile behavior that is attempting to capitalize, what appears to me anyways, to be attempting to capitalize on people's anxiety and fear and leverage that into a successful scam. So the conversation I had yesterday is really one of public awareness. I know that the policing agencies are aware and are doing what they can do, but I think it's just important for all of our residents to understand that those scams are active and they're there, and remain vigilant. Don't fall victim to that. The only reliable, the best and most reliable source of information about COVID-19 and all the city services is toronto.ca/COVID-19. That's the right source. Anything that's coming at you unsolicited and certainly knock at your door, my advice would be stick to the accurate information being provided by Dr. de Villa and the city on the website.
Do you know how many people have fallen victim to these scams at all, or is there a certain population being targeted?
I don't. I haven't been provided with any information with respect to numbers of victims, and nor do I have any detailed information with respect to who. Like I say, we became aware of the fact that this was happening, and as a result, we felt it was important to share that publicly, and hence why we raised it here at the press conference and through our other social media channels as well.
Hi, I have a question for Dr. de Villa. Early on, I think your office, unless I'm conflating offices, posted detailed information about a COVID-19 infected person taking certain bus routes through the city and so on. I don't think we've seen a lot of warnings of that nature since, and I was just researching what other countries are doing. The State of Israel, for example, seems to routinely post that sort of information of COVID-19 people, the past movements at very specific places, specific times through the community. They're about to take that up a notch. But I'm just wondering, for your office, can you just explain to me the logic of when you will go in to publicly disclosing that sort of information with the past travels of COVID-19 in infected people, and whether you'll be doing that as a matter of routine or whether that was a one-off sort of situation?
So when we have done case and contact investigations, when we've had identified cases of COVID-19, as we do with every infectious disease case, we conduct a thorough investigation and assessment of the individual case to understand, one, how they might have actually acquired the disease, and two, to determine who they might have exposed or transmitted the virus to prior to the diagnosis and the isolation of that individual. So in that particular case, one of the earlier cases of COVID-19 here in the city, it became clear to us that that individual may have exposed people through their regular commute on a variety of subway routes. And so we felt it was important to inform the public. So if those situations arise and there is risk that can be controlled and certain protective actions that can be taken by those who have been exposed, like isolating early so as not to continue transmission of the disease, that's when we take the opportunity to inform. But as we can see in other jurisdictions, when you have increasing community transmission, that becomes less salient information to provide, because once you have circulation within a community, then you have circulation within a community. So what I have seen, in fact, is as other jurisdictions have increasing numbers of cases, and as they see more community transmission, in fact, it becomes very difficult to determine and to provide that kind of data, because it's difficult to determine whether it was the exposure, in which direction the exposure was in.
So does your office still, I guess you're just asking for voluntary disclosures about movements and places at this time. There's no compulsion for people infected. But I mean, do you still, get this information even if you don't, post it on a website or in a news release or whatnot?
So we always conduct thorough case investigations and assessments. Of course, at a certain point, when you get to many cases, you may not be able to do that in quite the same in-depth way. And as we've seen in other jurisdictions, you move more to measures like mitigation measures and have to emphasize less on individual case and contact measures simply because of the volume and the numbers.
Dr. de Villa, I'm hoping it's great we get the daily sort of update and the new figures. I'm just hoping you can just frame everything. We've watched what's happened in Italy. We watched what's happened in Iran. So can you just give us a little big picture summary of where Toronto is and an honest assessment of how we're doing compared to the other jurisdictions we've seen this disease move through?
Well, you know, the interesting thing is when it comes to infectious disease outbreaks, you can never really tell the story until the end. That's when you actually are able to tell the complete story. What I can tell you now is that clearly places like Italy and places like Iran are further in the story than we are. They hit that increase. They have moved up their curve, if you will, the outbreak curve ahead of us. What I can tell you here in Toronto is that we have seen that increasing pace with more cases diagnosed in the last week and a half or so. So we are at that steep point, if you will, on that curve. Many of us have seen graphs of that outbreak curve, and there's a point at which it inflects up and it goes at an exponential rate. We are just at the beginning of that increase, I would say, not only here in Toronto, but in Canada.
But just what's next? Like, obviously, we could go one way or it could go another way. So where are we at on that? What comes after the curve?
Well, what comes after the curve depends on us, right? It all depends on us. What we have seen in certain jurisdictions, we've seen China, we've seen places like Singapore, we've seen places like Korea. You will continue to see an increasing number of cases. But the extent to which that curve peaks, how high that peak is, it all depends on how effective we are in terms of social distancing. That's the story we've seen from other jurisdictions. Social distancing measures applied at the right time and applied well actually help us to change the story. So the story, the power to change the story is entirely in our hands. Governments have come forward. They have put measures into place to help facilitate social distancing. It's now up to the residents and businesses of Toronto to really bring it home. We need your help to change the story.
And follow-up questions just on equipment. We've heard the concerns federally and provincially about ventilators and also tests. Is there anything on the city side as far as for paramedics or anything else that there's a risk that we would run out or have problems on actual infrastructure?
So I admit I am not up to speed with respect to paramedic supplies. I leave that in the very capable hands of Chief McEachen, and perhaps we can take that question offline.
Last question. Dr. de Villa, telehealth, Ontario Telehealth has been out of service for at least a few hours this afternoon. It may still be right now. They may have fixed it by now. But has Toronto Public Health been swamped today with replacement calls of people who can't get through to telehealth? I know Chief Pegg was saying the lines are already a little overloaded and go to the website. But has this telehealth outage affected Toronto Public Health?
I can't speak specifically to that. I can confirm, as Chief Pegg indicated, that we have had an incredible volume of calls to our hotline, and I imagine that if another source is having challenges, that we might expect to see increased volumes. But I should let you know that we are constantly training staff. We've expanded our call center capacity, and we will continue to do so as we seek to meet the demands and the questions of our residents.
Thank you, everybody. Thank you. We'll be in touch tomorrow about how we want to do this going forward. Thank you.